CDC warning hospital admissions and deaths will likely increase in the coming weeks as the record-breaking COVID surge continues. We are already seeing signs of it here in Georgia.
Right now, 24% of all patients staying in Georgia hospitals are COVID patients, and that's already up nearly 10% from just last week.
CBS 46's Megan Packer continues our team coverage tonight. Megan, you're live from Grady Hospital in Atlanta. The numbers there are steadily rising.
Yeah, Sean, we're seeing that really across all Georgia hospitals, and hospitals are already dealing with staffing shortages. This is just adding on to that. All of this is also affecting ambulances in Metro Atlanta and where they are directed. And tonight we are learning more about pediatric patients and how many children are in the hospital right now with COVID.
When we're looking at the increase in numbers, this is definitely a significant surge.
Hospitals are juggling a lot right now. The state's ER beds are at 86% capacity. ICU beds are 83% filled.
We're in the middle of our fifth surge of COVID.
Anna Adams with the Georgia Hospital Association says on top of that, staffing continues to be a challenge.
The staff are still completely burnt out, and we have people leaving the workforce altogether. It's something that we're trying to focus on, making sure that those mental health resources are available, trying to incentivize our staff to stay. But this is not a sustainable model moving forward.
Children are among those getting treated right now. Children's Healthcare of Atlanta has 118 patients with COVID in its 3 hospitals. 74% of them have at least one pre-existing condition. 8 days ago, there were 62 COVID patients. A week before that, 22. But the hospital system says it does have enough capacity to treat the young patients.
It's just always busy. Certainly the last 2 years has been a challenge.
Dennis Westover is with Metro Atlanta Ambulance Service. His crews are among those crowded hospitals are diverting to other facilities.
The trick is just keeping up with the hospital status, having someone that's dedicated that can, adjust and recommend to the crews other options for hospitals.
And I've learned people showing up to the ER to try to get a COVID test are also putting a strain on resources. So if you're asymptomatic, you're asked to go get your COVID test at a different location, like a community testing location or a health department building. We are live outside of Grady tonight. Megan Packer, CBS 46 News.
Thank you.